And it is now my pleasure to turn the webinar over to Jim Blumenstock. Jim, please go ahead.
Great. Urena, thank you so much. And hello, everyone, and welcome to today's webinar, Making Sense of COVID-19 Vaccine Polling Results. On behalf of ASTHO, the Association of State and Territorial Health Officials, and our partners, the National Public Health Information Coalition, we'd like to thank you for joining us for today's webinar. We really know how busy everyone is, and I can guarantee you today's program will be worth your while, and it really will enrich your knowledge on the topic that will be covered in the next hour. As Urena had mentioned, my name is Jim Blumenstock, and I am privileged to serve as the Senior Vice President for Pandemic Response and Recovery at ASTHO, and I will be serving as the moderator for today's webinar. This webinar will feature a meta-analysis of COVID-19 vaccine-related polling results and how public health can use this information to guide vaccine messaging, which will also be followed by a presentation on behavioral drivers of hesitancy and how CDC, our other partner, uses that knowledge to craft outreach materials. This webinar is, in fact, the first installment of the Ask the Experts Crisis Communication in COVID-19 series, which will be an expert-led series on developing clear, urgent messaging and communications around the COVID-19 response. This series is a joint effort between ASTHO, NIFIC, and certainly is supported with our great respect and appreciation by the Centers for Disease Control and Prevention. It really now is my privilege to introduce to you the faculty for today's program. Our speakers first will be Dr. Gillian SteelFisher, and then followed by Dr. Neetu Abad. Dr. SteelFisher is a senior research scientist at the Harvard T.H. Chan School of Public Health. She serves as the deputy director of the Harvard Opinion Research Program, HORP, and the director of its global polling unit. Dr. Abad is a senior public health scientist and co-lead of the Vaccine Confidence team in CDC's Vaccine Task Force. Now it's my great pleasure to introduce to you our first presenter, Dr. SteelFisher. Gillian.
Thank you so much for that warm welcome, and thank you to everyone who's joined us today. I'm going to go ahead and share my screen, so hang on while we get to this part of the ride. Okay, everyone. Thank you again for joining. I know many of you are focused on this incredible effort that we're taking on as a nation in terms of the vaccine rollout, and what I'm hoping to do is share with you information today that can be really useful to you, and to have you walk away saying like, gosh, that was a really good use of my time. So as Jim mentioned, we have a collaboration with ASTHO and NIFIC to work on trying to understand the public and health professionals' views about COVID-19 on various different topics. And we often do sort of a deep dive on a given topic, and we conduct our own survey. In this case, however, there are so many polls out there, and you've probably seen them, about vaccination that we thought, you know what? Let's see what we can extract from what's already there. Let's make use of what you all are seeing and help you try to make sense of it with an eye toward communication strategy. Now, polls are not actually designed to help us. They're designed for headlines. They are designed to sell newspapers. But if we reinterpret them with a little bit of polling and survey expertise, we can think about the takeaways that can be useful for vaccine communication strategy. I'm just going to draw on what's publicly available. So this is information that might come across your desk as well. I'm looking actually at all of the polls conducted between August and January. As of 2 days ago, so about 36 hours, we've been integrating new data into this. Looking at all of the polls that are nationally representative, so you can think about the data in that context. And all of them were conducted either by telephone or through an online panel. So it's really standard, but we're going to take a spin on it so we can really think about what's useful for you. And I'm going to try to give you 4 things to walk away with today that you say, okay, here's what I can think about. Here's what's going to shape my messaging for today and for tomorrow. Okay, so first thing I want to say is let's look at the polls with respect to the audience. Okay, key element of when we think about sort of being communicators. Now, many headlines would want to suggest to you that most people want to take the vaccine. I cite this example from the New York Times that says, fresh surveys show attitudes shifting and a clear majority of Americans now eager to get vaccinated. Now, that may make a great headline, and no critique of the New York Times on that front, but as communicators in public health, let's break that data down and take out what we need to actually develop appropriate messages and to understand the audience that we're looking at. So the way that headlines are coming up with that is that they're looking at it. This is one of the polls that was cited in that New York Times article. It's a poll from the Pew Research Center conducted in late November. And it asked people, if a vaccine to prevent COVID-19 were available today, would you definitely, probably not, or definitely not get the vaccine? And the New York Times, reasonable interpretation, and many of the polling organizations do this too, says, okay, let's add those two up. Definitely get, probably get, 60%. They go ahead and said eager. I'm going to say, I don't know if probably is eager, but set aside the, the line editing here. I would say from a communication perspective, I break this down differently. What I look at is actually, I look at the definitely group. This group has been shown to be the one that matters. Okay, so we look at, people say they're going to do something. If they're in the probably category, they're a little bit on the fence. I sometimes call that the polite answer. Okay, so when I worry about who's not getting the vaccine, I worry about everyone else that's not in this category. Then I think to myself, where's the opportunity? And to me, that's actually a pretty big group. That's the 52% who are leaning but haven't decided. They're probably going to get it or probably not going to get it. I think I can maybe pull them into the camp of moving them toward definitely. And as communicators, that's our goal. It's actually a pretty big chunk. So, but I wouldn't say we're at a majority already. I would say, about a third, right? We're in the, between a quarter and a third is in that definitely camp. Now we have our work cut out for us. So this opportunity and challenge of that middle bucket. Now this is true kind of no matter where we ask the question. Different wording, you get kind of the same theme. So I'm not picking on one question or another. I'm trying to think about insights that we can draw from across these different polls. So another question asks about being very likely, somewhat likely, not very likely, or not at all likely to take it. We still get about 46% in that leaning kind of a category. Now that group has been there over time. It hasn't changed all that much. So when I track this, Axios Ipsos did this series of polls and they asked the same question back starting end of August all the way through just a couple of days ago. And we see that that middle category, when I add together that somewhat likely and somewhat unlikely, that group has been about half for a while. At the very tail, at this very side over on the right here, we see it went from 51 to 41. I don't want to say yet because these things go up and down, but it's looking a little bit more positive. When I look at the latest data and I compare it, in December, I had 27% in that very likely category. And right now I have 39. So fingers crossed that we're moving in a good direction. And if we are, it's thanks to you all. So I don't want to be too optimistic here. My takeaway is still that there's big categories that we need to both be worried about and try to pull in. But we seem to be moving in the right direction, at least in most recent polling. So next message. Oh, sort of just a, quick recap. Really my takeaway is many people are deciding whether or not to get the vaccine. This is a challenge opportunity. So what we say now really matters. So what should we be saying? Okay, first thing the polling tells us is relates to messages about effectiveness. This is a key element, right? What do the polls tell us? First, they tell us that actually vaccine effectiveness does matter to the public. If we just look at the wording of different questions, we look again at our standard question here. If a vaccine to prevent COVID-19 were available today, would you be very likely, et cetera? In the same poll where there was different wording, where it said the coronavirus vaccine was determined to be 90% effective, that sounds like a high number to a lot of people. Would you be? We say there's movement, okay? My important category moves from 21% to 31%. So we know it matters. People want to hear it. But let's be honest, even at 90% effective, we've still only got 31% saying I'm definitely going to, I'm very likely to take it, okay? So how do we understand what it is about effectiveness that means something to people? Well, what I did is looked at questions about why people are motivated to get the vaccine. And what we see is that there's a lot of answers. This is a question, which of the following are reasons you would get a coronavirus vaccine? Top answers are pretty standard. Like, I want to protect my family. I want to protect myself. It's the best way to get, to avoid getting coronavirus. I want to protect my community. These are a little bit like, I want to take it because it will protect me. It will work. When you get into some of the other elements here, though, we can see some other messaging kind of information that would be helpful for communicators. What we see is that there's a sense that people are taking this because it's their ticket out. It's a reason to it's a way to get back to normal, right? It would allow me to feel safe around other people. Life won't go back to normal until people are vaccinated. It would allow me to go back to normal activities. That's what people really want to see. So what this means, right, is that how do we balance a little bit? I'm going to go back to the New York Times and say, well, what are we seeing? What's the interpretation in the media? Right now, public discussion of the vaccines is full of warnings about their limitations. They're not 100% effective. Even vaccinated people may be able to spread the virus, and people shouldn't change their behavior once they get their shots. While those things are technically true, from a messaging and communication perspective, we need to balance those caveats that we have, but still come forward with the message that this vaccine is a lifesaver. This vaccine, as far as we know, is safe and good, and that it will protect people. And that there's some chance that you'll actually be able to get your life a little bit back. Even in the small pieces that people are able to do, that's an important message. People are really motivated to take this vaccine to get back to normal. So if we don't balance the goals of transparency about those limitations with the true and full benefits, we could miss opportunities. It's a challenge, but I think you all are up to it. You guys are doing a great job so far. So, okay, next, what about messages about safety? What does the polling tell us about safety? Another key element that we're probably all thinking about or doing something about in terms of messaging. So certainly safety is a key issue for those who do not want to get the vaccine. Okay, so this question is like the opposite question. Before we ask why you're getting the vaccine, now I'm asking the people who aren't going to plan to get the vaccine, why not? And what we see is that the top reasons all relate to safety. I'd be concerned about side effects. I'm concerned about the development and approval process. I'm concerned about actually getting coronavirus from the vaccine. Now, these are all related to safety, but from a communication perspective, so headline here would be safety matters, right? But you all are communicators. What do we take away that's going to give you more insights for messaging? The first dimension, let's look at this last category here. I'd be concerned about getting infected with coronavirus from the vaccine. 37% of those who aren't going to take it say that's a reason why. Okay, well, we all know you can't get coronavirus from the vaccine. So getting that message out there is really critical. Saying it over and over, that should be in your key talking points, right? You might be able to address that with that. Now, there's a big concern here, which is I'd be concerned about side effects from the vaccine. Now, this is complicated because there are some side effects. There are a risk of negative side effects. And what happens is that in the media, when that story is pushed over and over again, it makes people think it's more common than it is. So we all know that the public in general does not think in probabilities. We do not understand risk assessment in the way that a statistician does, that people are judging like, how much am I hearing about it? So if they're seeing it on social media, they're seeing it in headlines that there are these side effects, they just think of it as happening more often. And as public health communicators, we have to think about how to make sure those messages come in context, that this is really rare, that there are some people who are really at risk, but most people it's really, really, really rare. How do we get that message out? And thinking about how you make sure that's part of your key messages, and that when you talk to the media, you're helping to put that into context. The other dimension that relates to safety is that people are concerned about the development and approval process. Underlying that is a concern about the safety of the vaccine and how it was done, right? That's a tricky message, because that's not just a matter of saying over and over, it's safe, trust us, it's safe, right? We've got to think about who is the right messenger to give that message. Who do people already trust? So we looked at other polling questions about who people trust. And what we see across the board is that two things. One is there's not as much trust in various institutions as you might think. So this question asked about how much people would trust the following sources for information about coronavirus vaccine. And this is a summary of a great deal and quite a bit. What we see is that for most groups, it's less than half. And when we think about news media, we're at 16% have a great deal or quite a bit of trust. So it's not, we're talking about, folks who are in public health agencies are closer to the top of this list, but still it's not way up at 100%, right? It's not 90%. It's less than half. So across the board, the folks who have the most well trusted are health professionals in almost every poll. So you want to think about people who look like they are physicians, nurses, pharmacists, they have the clinical expertise and more, as we'll talk about that. So these are the people that from public health messaging perspective, we want to push forward and be kind of the message senders. So thinking about kind of recap on the safety issue, the perceptions of safety are important, right? We've got to have a message about them, but they're complex. So stories about not being able to get infected from the vaccine may need frequent repetition, right? We might be able to address that one. But the frequent media coverage about side effects can distort views. And so you're going to want to think about how to make sure that when you're talking to the media, you put that in context, that that isn't sort of the front of everything that you're presenting, and think about how to make sure that people aren't seeing that over and over and over again and not other elements. And also keeping in mind that we're sort of starting from a limited trust for many sources of information that provide that technical information on safety. And so wherever you can put health providers at the top, put them forward. They're going to be kind of your best bet on getting that message out. Now, we're all in public health, and many of us are focused on trying to reach those most vulnerable. And in this case, that is people who might be more hesitant about getting the vaccine, as well as those who are more affected by COVID, a greater burden of COVID itself. And in some cases, unfortunately, these align. So one of the groups that folks are quite concerned about reasonably is that we've seen in some of that early polling data, there's a lower predicted uptake among Black adults. And there, in that early data, and now that you all are polling experts, I'll show you where I was a little bit skeptical, is showing sort of fewer differences between white adults and Latinx adults. Right? If we look at this data, it says, would you get, if coronavirus was determined to be safe by scientists and was available for free to everyone? It's about as good a description as you can get in a poll. Would you? Definitely or probably get it. And back in late November, early December, 62% of Black adults said they would be definitely or probably get it. 71% and 73%. Okay. The more recent data that I'm seeing is actually, let's break it down the way that we were all talking a few minutes ago. Let's talk about that group that's definitely alone. This data wasn't presented back in November, December. And what I'm seeing here is that when you add it up, okay, in this larger group, actually doesn't look like a lot of differences between Blacks, Hispanics, and whites, right? 60%, 65, 63. But in that definitely get category, that's where we really see a difference. It's 46% compared to 28%, 46% compared to 31%. So what we're seeing is, and part of what I think is happening, is that people are just kind of reasonably nervous about kind of being the first in line. So this question asks, if the coronavirus vaccine becomes available at no cost to you, would you get one as soon as possible? Consider one, but wait to see what happens. Never get one, right? Now, those categories are really important because what we're seeing is that the never get one, there's a little bit of difference between Black adults and Hispanic adults and white adults. But the real big differences are really in the get one as soon as possible. So this is about kind of concern about not wanting to be frontline, not wanting to be maybe mistreated, right? So let's think about what might be kind of underlying this, because as messengers, we do want people to get one as soon as possible because we do think that it is safe and effective for them. So we think about sort of what some of the underlying reasons are, and we think, okay, well, trusted information sources, right? So this is something people always go to. Who do you trust for information, and is there a real big difference? Is that what's happening? So the data in terms of sort of racial ethnic groups' reliance or trust on information sources is a little bit mixed. So we see that actually there's not huge differences between Black adults and white adults in terms of trust in various information resources. There's some difference where Hispanic communities are less likely to say they're trusting these different resources, but it's not huge. This doesn't explain reluctance in the way that you might think. And I think it requires us to dig a little bit deeper and think about broader mistrust in the institutions as acting on for people's benefit and their welfare. So these other questions, I think, give voice to this a little bit more. So confidence in the system of the way it was developed, that's where you begin to see bigger differences. How confident are you that when a coronavirus vaccine becomes available, it will have been properly tested for safety and effectiveness? So this question was asked a little while ago before it was available. And we see differences here between Black adults, Hispanic adults, and white adults. And also this idea, that people are acting in your best interest. Like, do they actually have your best interest at heart? Or is it something else? May not know what the technical difference is, but something just isn't right. And we see that white adults are much more likely to say that they have confidence that medical scientists, for example, are acting in the best interest of the public. 43% compared to 30% compared to 33%. When we look at surveys that are about sort of deeper mistrust in broader institutions, we see really big differences. Okay, so we ask people and we look along racial ethnic differences, we see 59% of Black adults say that they can trust doctors to do what's right for their community all or most of the time, compared to 78% of whites. And Hispanics sort of fall somewhat in the middle there. Local hospitals, 56% to 70%. Local schools, the healthcare system, 44 to 55. And not surprisingly, police and courts are some of the biggest disparities. But thinking about whether or not institutions actually are acting in people's best interest, that's a fundamental issue of mistrust that we really need to be addressing in public health more deeply. The other dimension that I'll mention is that a recent poll suggested that people of color in Black adults and Hispanic adults were also less likely, or the way this data is, but I'll say it the other way around, more likely to say they don't have enough information. So there's an eagerness there that we should tap into and make sure that people do have the information they want and need. So you are needed, you are being called, and there's a receptivity here that I think we need to leverage. The other piece to think about is that there are other groups who are also more reluctant. And we think about more conservative adults who may be more reluctant to get the vaccine. The way that polls work is that they're by party. That's like, polls come out of the political world, so we have to kind of look at it from that lens. And we see in this context, some of the polarization that we've seen across the board comes down into vaccines as well. So what we see is really big differences between Democrats and Republican adults, talking about whether or not they would get a vaccine when it becomes available to them across multiple questions. We also see that there is huge differences in terms of trust in information sources. I think these are some of the most dramatic data here, when you can see, excuse me, that in every case, there are differences of 20 to almost 40 plus percentage points between Republicans and Democrats in terms of which source of information they would trust. And of course, when you talk about a candidate, or this was when President-elect Joe Biden, before he was president, you can see huge differences in terms of trust in the leaders of different parties as presidents. So there's also a difference in terms of sort of being able to act in the best interest of the public. So from public health communication perspective, how do we deal with this? What do we do? And I think the takeaway is to think about the fact that trust is more than just a technical trust in the information. People have reasonable questions, given an immense history about the way that they've been treated, and concerns about that will continue in this new context. So thinking about ways to communicate and to address the fact that people may not believe these institutions will act in the community's best interest. Thinking about bringing together doctors who are reflective of diverse populations, they can be really effective messengers. They embody that technical competence we need, but also the sense of caring for the community. And so thinking about making sure that we have excellent physicians of color on the front lines, and we also have physicians from more conservative states, more conservative institutions that are coming forward and motivating people to get the vaccine. This is kind of one of our key strategies in terms of the next element that we can think about as pulling from the polling data we have available. So with that, I will thank you and turn it back over, and we'll answer questions as we go forward to the next presentation. Thank you all so much.
Jim, you are muted.
I don't know how that happened, but can you hear me now? Great. Well, Gillian, thank you so very much for that. And besides your 4 takeaways, the rich information that provided the background analysis, I think, will generate certainly a lot of questions and discussion, and will really benefit all of our viewers. So with that, I want to remind everybody that you will be able to answer questions to our panelists in a few minutes. So please feel free to add any questions into the box as we continue. So now it's my pleasure to introduce to you our next presenter, Dr. Abad. Neetu, let me turn it over to you.
Thank you so much. And yeah, just wanted to say thank you to Gillian. It's always a really treat to hear you speak. And that was an absolutely fascinating presentation that I think goes very nicely into what I'm going to talk to you about today. So yes, I am Dr. Abad. I'm a behavioral scientist, social psychologist by training, and I co-lead the Vaccine Confidence team. And I'm going to talk to you about our Vaccinate with Confidence team strategy and more about engaging communities to increase confidence in COVID-19 vaccines. Next. So here I just want to kind of frame the question about why is it that we want to reinforce confidence in COVID-19 vaccines? And I have a number here that Gillian probably could pick apart, but we do know that we do have some faith in the safety and efficacy of vaccines and some enthusiasm to get that vaccine. And we know that when folks are thinking about that, they think about what are the side effects? How well does it work? How safe is it? And what is it going to cost me, both opportunity costs and financial costs to get vaccinated? We know that the COVID-19 vaccine is considered more acceptable if people's providers say that it's safe, if there's no cost to the individual, and if it would really help them facilitate getting back to school and work and resuming their life. So we know that these are factors that weigh on people's minds. Next. And here is some data as well that is from December 2020. And I know that there's been some recent updates and some of this has stayed consistent. But from this Kaiser Family Foundation data, we know that geography, race, ethnicity, political affiliation, employment, even voting preferences, these are all factors that contribute to willingness to get vaccinated or willingness to, or vaccine hesitancy, not wanting to get it. In these groups where we are particularly concerned about folks who do not want to get vaccinated, we know that there's overlap where mitigation strategies of mask wearing and social distancing and the other tools that we have to fight COVID-19 have not been widely accepted. So there is a linkage there in sort of perceptions towards the vaccine as well. Next. We really feel that as we're developing our Vaccinate with Confidence strategy and initiatives, that it is our job to let communities know that it is okay and valid to have questions about the vaccine, especially for those who have been hurt by societal systems. It's a new vaccine, it has new technology, and they're having questions is actually quite normative. Where we get concerned is when there have been traditions of inequality, inequities, unethical medical treatment on certain populations, racial ethnic minorities, and those experiences have over time led to what Gillian has really nicely portrayed as a mistrust in systems. And that is something that as we deal with this unprecedented rollout on a historic level that we need to contend with to have a successful rollout. Next. So on our team, we spend a lot of time thinking about vaccine confidence and how do we define it. And what we really think ultimately is that vaccine confidence is the trust that patients, parents, and providers have in the vaccines themselves that are recommended, the providers who administer the vaccines, and the processes and the policies that led to the vaccine development, licensures, manufacturing, and authorization processes. So it's really a systems perspective that we take to the topic of vaccine confidence. Next. And this is a slide that we like to show to demonstrate that vaccine confidence is a dynamic sort of a state and is expressed in behaviors. And you can range from refusal of vaccine to demand a vaccine. And then there are kind of passive acceptance or sort of coming across information about vaccines. Rarely do we see a situation actually that we see even today, which is tremendous demand for a vaccine, and then also a hesitancy or sort of wondering where we stand on the vaccine. So it's a very interesting situation facing us with the COVID-19 vaccine rollout. But what's important is that there are many who are in this wait and see period, kind of the movable middle. And those are folks who have questions that can be answered. They have not decided definitively not to get vaccinated, but they really want to know more about the process. And those are the folks that we can reach and that we're trying to reach with communication, but then also facilitating greater access to the vaccine as well. Next. This is, it's often helpful to think about in kind of a behavioral model format of what are the social and behavioral factors that really we believe drive COVID-19 vaccine uptake or vaccine uptake more generally. We know that there are individual level risk perceptions. So this is an individual level belief in the benefits of the vaccine, belief in the vaccine safety, also knowing that you may be at risk for contracting COVID or having a severe reaction. knowing, seeing negative information or misinformation. These are all kind of things that might affect individual perceptions of the vaccine. But there are also social processes like social norms, vaccination norms, workplace norms, things that other people around you are doing that might signal to you what is an appropriate behavioral response to get vaccinated or not. Whether or not you can make your own decisions about getting vaccinated, or if there are other factors in your social network. All these things lead to kind of your intention to get vaccinated or your motivation to get vaccinated. But it's not just kind of psychological or sociological factors. There's also a lot that has to do with access. How easy is it to get access to the vaccine? Are vaccine sites available that are close to you? Do you know where to get information about the vaccine or actually get vaccinated? And do you have experience interacting with the vaccination system, as an adult? Maybe you get the flu vaccine. So all of these things kind of come together to create the picture of whether or not you decide to get vaccinated. So it's important to remember those factors. Next. So now to switch gears a little bit and talk about our team at CDC, the Vaccinate with Confidence team. We are a multidisciplinary team focused on diagnosing and addressing vaccine confidence challenges to promote high uptake of COVID-19 vaccines. We have experts in behavioral science, communication science. We have individuals who are managing very complex and diverse partnerships across federal agencies. We have folks who are focused on community engagement. And we also have clinicians on our team who are advising about that really critical healthcare provider-patient interface. And our work is really to develop strategies and initiatives that are in line with our Vaccinate with Confidence framework. Next. So there are 3 pillars to our Vaccinate with Confidence framework that we're operating with at the CDC. It's build trust, empower healthcare personnel, and engage communities and individuals. Next. So let's look at that first one. The objective in building trust is to share complete, clear, and accurate messages about COVID-19 vaccines and take visible actions to build trust in the vaccine, the vaccinator, and the system in coordination with federal, state, and local agencies and partners. It's a big moving kind of pieces, but throughout we want to have transparency about the processes, and recommendations that we're giving, the guidance that we're giving, and really clearly and effectively communicate that to our target audiences. Next. We're also very focused on empowering healthcare personnel. We wish to promote confidence among healthcare personnel in their decision to get vaccinated and also to recommend vaccination to their patients. So healthcare providers really have this very interesting dual role where they are getting vaccinated. They're among the first to get vaccinated, and they're also recommending vaccination to their patients. So they're absolutely critical pieces of the system where individuals where we need to focus on instilling confidence in the vaccine and explaining as much to them as possible so that they can communicate effectively with their patients. Next. The third bucket is really about engaging communities and individuals. We want to engage communities in a sustainable, equitable, and inclusive way using two-way communication to listen, build trust, and increase collaboration. And it's really that two-way dialogue that is the most pressing, urgent, and interesting pieces to us. We want to empower recipients to share their stories and reasons for vaccination within their social networks, because being a vaccine ambassador in your own social network is a powerful way to motivate others to get vaccinated. Working with health departments and national partners to engage communities around confidence, including delivery strategies for the vaccine, and making sure that we're collaborating with trusted messengers such as faith-based leaders, other community leaders to tailor and share culturally relevant materials and messages. Next. So this is just an overview of some of the initiatives and objectives that map onto our strategy that we're developing to kind of, to help especially states and jurisdictions and others kind of manage vaccine confidence. So we are building an insights unit to triangulate and analyze different types of data, behavioral data that comes from different places to understand what's going on with the populations that we're most concerned with. And we have an emphasis on digital data because, as we know, people are having more conversations online and sharing more information in digital spaces, and we need to understand how that's happening and how that's affecting their perceptions of vaccine. We're really trying to draw on expertise from different health areas. We have behavioral scientists at CDC who have been focusing on HIV prevention, STD prevention, opioids, et cetera, who have a wealth of experience when it comes to understanding the massive effort that we are undertaking with COVID-19 vaccine rollout. And so we're drawing on their expertise to kind of frame the way we're thinking about this. In addition to the insights units, we're sort of tracking vaccine confidence and developing reports that we're sharing with others. We have a diverse network of partnerships. This is one of the most critical things that we're doing, is building and maintaining our communication with different types of partners. Communication toolkits. So we currently have toolkits for healthcare providers and others in the health system, long-term care facilities, community-based organizations, and others are coming online. We are developing confidence consults, and I'll do a deeper dive on that in a minute. Strike teams, which are assembled to help states and jurisdictions on a deeper level if there are deeper needs. Rapid community assessment guide, which I'll also explain a little bit further. Bringing academic institutions to collaborate more fully with states and jurisdictions on identifying and rolling out solutions. And we're also thinking about, the human resources component of overworked and overstretched health departments who need some more capacity in certain areas, potentially with understanding and doing digital listening and understanding kind of what the information trends are in their area. And of course, sharing best practices. Nobody learns better from you than others who are in similar positions as you. And the things that you are learning to do, best practices, we want to be able to share those with others. Next. So just, and I know I'm coming to the end of my time, a couple of initiatives, just a little bit of a deeper dive. We're developing a rapid community assessment guide so that states, local immunization program managers, others in health departments, community-based organizations, hospital systems, and others can use our guide to better understand and address community needs around COVID-19 vaccines. We'd love for this guide to help identify populations at low risk for COVID-19 vaccine uptake, can document lessons from previous vaccine rollouts, phases of the rollout, identify who your trusted messengers are and what the important spaces and channels are to work in, what the barriers are in your communities to affecting uptake of the vaccines, and also really a focus on implementing and evaluating strategies or interventions to increase confidence and uptake. Next. The processes here, it's sort of a cycle of participatory kind of collaborative research or implementation science. We have identifying of your objectives and your communities of focus, planning for the assessment, so assembling a team that can do this, collecting some light touch data, which I'll explain in a minute, and reporting that data back to your communities to help think about solutions that could work, and then implementing and testing those solutions. So we have vaccine rollout, template guide, key informant interviews, listening sessions, attending town halls to see how people are, virtual town halls to see how people are talking about the vaccine and taking down insights, and also doing some social media monitoring. Next. We're also very excited about the COVID-19 vaccine confidence consults. We're providing phone and virtual support for state and local territory immunization programs, local health departments, and immunization coalitions. We are providing technical assistance to build vaccine confidence and to promote COVID-19 vaccine acceptance. So these phone calls are going to kind of deal with how do you diagnose challenges and barriers, how do you provide guidance on research and best practice, sharing with you relevant resources and tools, and linking to specialized experts and organizations that might help you further solve your problems or challenges. But it's really kind of going through what seems to be a current problem and how can we help you address it. Next. We're also very excited about the FACT Alliance. which is the COVID-19 Facilitating Acceptance with Community-Based Trusted Messengers. And this is an intersectoral partnership where we are working with national organizations that represent community health workers, pharmacists, nurses, and faith leaders as trusted messengers in many communities, and encouraging them to share, sort of work on strategies together, share best practices in developing relevant and tailored messages, and other types of activities that we want to encourage collaboration on. So those are some examples of some strategies that we're pursuing, and we're really excited to talk to you today and kind of get to the Q&A so we can get a little bit more deeper in the issues that you may be facing. Thanks.
Great. Neetu, thank you so much for your excellent presentation. And, you know, we were so pleased that we were able to really showcase the Vaccinate with Confidence effort. And for those of us who have watched it mature from a framework to a strategy to now learn more about the suite of services and products available and more to come is just remarkable and certainly sorely needed, and it will add to the level of effort going forward. So thank you to you and your colleagues for everything you've done in this capacity as well. So well, we now have time for questions, which is great. But first, we'd really appreciate it if you all would take a few minutes to complete a quick webinar evaluation. The link is available in the chat. So as we transition to our conversation and question and answer, I'll ask Urena to remind us how to submit your questions, and we'll get into our conversation. And Urena, if I could ask you to do that.
Yes, thanks, Jim. So as you can see on the screen, we are taking questions through the Q&A. So if you would like to submit a question to our speakers, you can locate the Q&A box in the toolbar at the bottom of your Zoom window. When you click it, the Q&A box will appear and you can type in your question and hit submit, and we will present them to our speakers.
It's as easy as that. Thanks so much. So while you all are gathering your thoughts and submitting the questions, we do have a few in queue. So what I'd like to do now is turn to our colleagues at NIFIC who have some questions already positioned to share with our faculty. So please begin.
Thanks, Jim. This is Tom Schaefer from NIFIC, and I had a question either for Gillian or Neetu or both. And I know there was a lot of discussion, about reluctance and people getting the vaccine, but I kind of want them to speak to the flip side. I heard today that the vaccine rollout in some ways was being described as like the Hunger Games. So we have a lot of people out there that want to get the vaccine that are getting discouraged. How do we keep them motivated? And were you seeing anything in any of the polling that suggested that people were just getting discouraged and we're going to just not get the vaccine because of the rollout?
Thanks, Tom. Excellent question.
Well, I'm going to give Gillian if she's got any polling insights on that, but I'm really glad you asked that, because that is absolutely true that is also happening. It's actually this very confusing state where we have folks who don't want the vaccine, but then folks who really, really want the vaccine are willing to do a lot to get vaccinated. And so you've got these kind of dual forces happening at the same time. We sort of call it like misadventures in demand, because it's there's this complex process that you have to sort of follow. So I think that we need to figure out a way to, really harness folks' motivation to get vaccinated, and what can we do while they're waiting? How can they be vaccine ambassadors in their communities and to people in their networks? Can they drive grandma to get vaccinated? Can they do something that makes them feel like they're a part of this, but not, discourage them? I think when this goes on for a long time and you have people who really want to get vaccinated who can't, it can also have an impact on their trust in the system as well. So I think we need to pay attention to that. But I'd be really curious if Gillian has got any polling data about any of this.
Okay, so I'm glad you started off with an easy question. Just kidding, Tom. Just kidding. It's a hard one, but it's one that we've seen before. So we've seen this in a lot of initiatives. So we look back at H1N1, where initially, there were so many people who really, really wanted the vaccine, and then, over time, it just falls off, right? Because you could have vaccinated that group. And so I think about the messaging right now as being appropriate in the current context, which is to say, how do we leverage what's good so that we can connect with the people who are eager? And then over time, as like that group gets vaccinated, right, our strategies will actually have to change. So setting that aside, what do we do now when we've got sort of like, you know, these two parts? So I think the first thing to think about is the fact that it's inescapable that operations and communications go together. So anyone who's here, who's sitting on the communications side, and, you know, sometimes you're like, well, communications, you know, like operations kind of is the front of a lot of public health initiatives, and the communicators are in the background like, don't forget about us, like it matters. This is a place it really does, okay? So this is a place to come front and center of the table and stake your claim, because this is really important where you are. You know, working to make sure, I mean, there's no better replacement for action like having a relatively functional rollout. And then talking about making sure that when you have, if you're on the communication side, having messages about places where in your district it is going well, making sure that reporters are aware of that, because we know that reporters love to focus on the bad, right? American media coverage inevitably is like, you know, just sort of turns to the negative. And so what we try to make sure is that that's, you know, that isn't everyone's experience, but there's like, you know, images of people in long lines, et cetera. Make sure you have images of people happily getting the vaccine. Make sure that it means you have to actually be doing that. I'm not suggesting to sort of, you know, voice untruths. I'm saying while you're working alongside your colleagues on the operations side, make sure you're getting the good stuff too, and that you have that at the ready so that you can get messages out there that are more encouraging. The other piece is that it's not clear, you know, some of the data that's coming out from the polling. So the people, we don't have polls of people who are trying to get it. It's just too small a part of the population as yet. But what we can see is that the people who are trying to, you know, as they're getting it, we see that people can sort of share their stories. So sort of, you know, making sure that you have a way for people to talk about what was good about getting it. And also that people can understand, the one thing we do see from the polling is that people understand why certain groups are prioritized. So understanding how that might benefit the larger community, it's not as good a sell as getting it yourself. Like, I'm not pretending like altruism reigns here. It doesn't. But making sure there's some questions in the polling data about whether or not people understand enough who are the groups who are getting it and why. And that's actually not quite clear to people yet. So that might be another important message to kind of get out there, which is to explain, like, here are the groups that are most at risk. This is how they're getting out, and showing successful outcomes when that happens.
Thank you. Thank you. Nifik, Tom, do you have one more question before we go to the audience?
Yeah, so this is Laura Espino. So I just had, Gillian, probably it might be better for you, but any takeaways for combating COVID-19 public health mitigation messaging fatigue? Because everybody is, that's just seems to be the top of a lot of our folks that are dealing with. Do you have any insight in there from those?
Well, I will try to, Laura. So again, I'm glad you guys are giving me all the lowball questions. So this way we can just, this is an easy one to solve. It's not. But I do think there are tremendous opportunities with the vaccine to combat some of the fatigue. So there's a little bit of a balancing act here.
Yeah.
But right now, you know, there's a lot of us staring down a long, cold winter ahead. You know, the idea of what we can actually look forward to, I mean, it is actually an amazing accomplishment, right? Less than a year ago, we were in a place where we're like, are we going to have a vaccine? What's this going to look like? You know, I mean, think about where we were. And I think it's easy to forget what that's like. And right now, 10 months into this, people are all feeling like, oh my gosh, like, when will this end, right? But we are at an amazing turning point. So I think having some of that messaging, people are now actually looking for a little glimmer of hope. And I guess I would go back to kind of one of my points in terms of the takeaway. Balancing the caveats about the vaccine, which I understand have to be there, and I'm not saying we shouldn't say that, but offering people the true beauty of the vaccine too, which is like, it can make things a lot better, right? Like, vaccines are game changers. And making that message a bit clearer, I think, can help combat some of the fatigue. You will then run into the issue of like more people wanting the vaccine, but hopefully, you know, we're going to be able to keep up supply with the demand in a way, and all of these pieces have to move together. But I think there really is an opportunity to move past the just sort of like, oh my gosh, when is this going to be over? I might as well just go out, right? Like knowing that there's a concrete timeline, understanding where you are in that line, and seeing the vaccine as something that will be a game changer for you individually as well as for your community, I think can go a long way toward combating this fatigue.
Great, thanks.
Excellent. Thank you. Laura, thanks so much for asking that question, and Gillian, again, for a great answer. Erica, let's go to our listening audience now and some of the questions that they have possibly have posed. Can I turn to you?
Absolutely. Thanks, Jim. So the first two questions we have are about resources. The first is, in general, will there be a central clearinghouse for all resources for communicators as they become available? I think that may be for you, Neetu. And a specific question about working with a local university to study the local population's vaccine enthusiasm. Is there a tool that either of you may have that could be used by our general audience?
So yes, as resources, as we develop them and they get cleared and they become available, they will be on the CDC website, and I can I'll follow up and try to provide some links to those, to the ones that are. So like I said, we had toolkits for those in the health system. We've got toolkits for those who are trying to reach community-based organizations, long-term care facilities. We've got more on the way. So yes, they definitely are trying to make resources available as quickly as possible. Those rapid community assessment guide, as well as the confidence consults, these are quickly going to become online. And I'm sorry I didn't get the second part of that. Can you repeat that, Erica?
Sure. So yeah, so Grace Kelly McGovern is looking for a specific tool that she can use to help her work with a local university to study their local population and their vaccine enthusiasm. Is there something specific that you may have?
Oh, that's a great question. So yeah, so the rapid community assessment guide is going to have those like listening session, kind of guidance, key informant interviews, all these sort of data collection type tools. And one thing that we are advocating is if there is a way to partner with universities that you may have a relationship with who can help you collect some of this data. We're also designing these tools so that, you know, if you don't have those partnerships, that's okay too. You can run a listening session, you can get that sort of information. And I think this focus on vaccine enthusiasm is really great too, because you want to find ways, how can you tap into people's motivation, enthusiasm, willingness to get vaccinated, not just the barriers, but also the opportunities to amplify your message and to kind of sort of socialize that and get people motivated. So I think that the questions that we'll offer will, you can tailor those and you can sort of think about innovative ways. You can also, you know, do a lot of digital listening. There are freely available tools to see what people are saying and tracking it. You don't always have to track negative information. You can track how people are speaking positively about the vaccine and what kind of information they're sharing across their network. So you can do that, you know, now using, you know, different freely available tools. So that's my answer. I mean, if Gillian wants to add on to that.
Well, I think when you're able to share those resources, I think that sound like they're going to be great. So hopefully that can happen quickly.
Great, thank you. Erica, we do have time for a few more. We'll turn to you.
Yes, I do. The next question asks, how can public health best use social media to get appropriate and accurate messaging and follow-up?
I'll take a stab at it.
Gillian, we'll give you
have other ideas. So, you know, I think there's no doubt that social media is playing a role in how people perceive the vaccine rollout, right? And so people sharing their stories about what happened, what didn't happen. I think, sorry, I think there might be someone.
Maybe we lost
I'm
Gillian.
back. It's not me.
Okay.
I don't have cute children right next to me, although it sounds like a good idea. What I was saying is, you know, there's no doubt that social media is playing a role, right? So the issue that we have to be out there in terms of public health. And so I think the key is, you know, people may not want to follow the local public health agency, right? So that's not kind of as intriguing maybe as some others. So you have to get other ambassadors to do that work for you. Helping to develop and craft messages and having them share those messages, I think is really kind of creating a network where it doesn't have to be you on the front line to make a difference. So it doesn't have to be how many followers the local public health agency or state public health agency has. Most of those followers are going to be reporters and others. If you're trying to get to the actual public, you need people that the public really wants to connect to. And so linking them in as part of your social media strategy, it can't be a solo affair. So I think then thinking about how those messages fit in, I think is really the key to using social media effectively in this context. Neetu, I don't know if you want to add anything to that. Or
I just think our social media channels are fantastic and everybody should be following CDC getting information. No, it's true. Look, you know, we aim to provide accurate, timely information, and we also work through partners to get messages out, and that's really an effective way to reach communities. And so figuring out where your kind of influence, like what your strategies are for that, and where you can amplify messages, I think, and do it at the most local level possible. You know, there's a lot of analogies to kind of get out the vote campaigns and different kind of voting behavior strategies. And I really encourage us to look at those, because it's about finding the right people to talk to the right people that are trusted, that are motivating. And it's also about making a behavior really easy to do. So those things need to happen together in order to kind of see behavior change.
Okay. Excellent. You know, if I could take the prerogative and maybe ask a somewhat of a related question. You know, Gillian, in your presentation, one of the many things that caught my attention was, and I think it was in the trusted agent slide, where it showed that local schools were ranked pretty high, and I think even higher than healthcare facilities, if I'm not mistaken. And it also showed that in the different demographic groups, there was sort of an equal level of acceptance. So I'm just curious, do we think that local schools possibly are an underutilized resource? And, you know, is there an opportunity here, whether it be through traditional outlets or through social media, that local school systems could play a bigger role in education and information sharing?
It's interesting, Jim. I think that the slide you might be referring to is actually showing a slightly different point, which is just that the sort of trust in the various social institutions. I think this might be the slide you're thinking of. Let me just see if I can share it. Make sure that I'm. Is it okay if I share? Someone give me the yay, nay.
Go for it.
Okay, thanks. I don't know if I take over the screen. Okay, here we go. So I think this may be the slide that you're thinking about, which is,
right.
You know, and I think this is really about kind of the larger social infrastructure trust. And I think the real issue is thinking about the fact that, I mean, so local schools and the healthcare system are sort of equally trusted. This is not having to do with vaccines specifically. It's like just broader infrastructure. So I think what's interesting here is that actually, even within this context, healthcare is a relatively well-trusted institution, but there are still huge gaps. And so it's really about kind of addressing those gaps that we need to bring forward. And I would still push, and I hope, I know, Neetu, you were mentioning, you know, who your trusted ambassadors are, and I didn't see doctors on that list. And I would love to add doctors to that list. I know you have pharmacists and nurses and community health workers and faith leaders, but I would put physicians on there. There's a different relationship there, but they're so well trusted in so many different contexts that they can really be kind of a force for good. I know they're overloaded. I know they got a million things to do, but they really make a difference. And I think that's really where I would put my money.
Great. Well, thank you so much for that clarification and amplification. That's very helpful. Thank you. Erica, I think we have time for one or two more questions.
Sure. So there's a pretty significant urban-rural trust divide in our state. Are there any insights from polling about how to best develop that trust in rural communities?
So thank you for raising that point, folks who brought that in. It's really a critical issue. And we do see that, you know, there's some alignment between rurality and between other kinds of conservativeness, and then also in terms of sort of feeling of exposure and risk. And these are all contributors to why we're seeing the risk of lower uptake among rural communities, even though many have been really, really hard hit by COVID-19. I think the principle here is the same, which is that when you're talking with a community, you have to have someone from that community, right? It's not about being an outsider, right? It's about coming in and saying like, okay, who's a trusted resource? And so finding the folks in that community who are well trusted to share the message is really critical. I don't think we can build it out. I don't think you can say, trust us, trust us, trust us, trust us over and over again, and it's going to work. You have to have a messenger who is trusted and build out. I think of it like little islands of trust, right? You start with where there is trust and build out from it and build the bridges from there. And so it's really important to think about what partnerships make sense in there. I would still encourage you to think about physicians particularly, but in rural communities, there may be other folks who are really well trusted in that particular environment, who have kind of culturally connected experiences to speak to, and can really make that connection.
Yeah, I completely agree with that. I think that's absolutely right on. The same strategies that would work to reach other communities. It's just that we have to figure out what those are, because I mean, from from where we are, we have we're kind of really trying to ideate ways to reach rural communities, and we have experts within CDC we've been talking to, and we've discovered, you know, mayors are important, and we're trying to talk to them, other types of community leaders in those communities, and get a sense of what's going on there. So we're really trying to develop strategies, and I think that they also need to see themselves on the national stage, you know, having a stake in what we're doing, see themselves as part of the conversation, because we also are very interesting times, and we also have to acknowledge the sort of political realities of where we are too. And so we need to contend with all of that and develop strategies that are going to reach everybody.
Excellent. So unfortunately, our time together this afternoon is coming to an end. Great presentations, excellent questions and conversation. So I really hope everyone felt that they benefited from our hour together. So please join me in sharing somewhat of a virtual thank you to Dr. SteelFisher and Dr. Abad for outstanding work that they're doing and for sharing that with us today. As a reminder, for those of you who are still with us, please take advantage of this opportunity to provide us with your evaluation of today's program. It'll be up on the screen for a few minutes after we terminate the presentation. The recording of this webinar will be available on both ASTHO and NIFIC's websites. So that gives you the opportunity to share it with your colleagues at work, or to go back to some of the specific information that was presented in their PowerPoint presentations. So again, we want to thank you all very much for your interest and your participation in this program. Certainly there will be more activities and opportunities like this to engage on this critically important topic. So thank you so much. Please be safe, and feel free to disconnect because our webinar today has now been completed. Thank you very much.